Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Coming into the contradictions for RFA. What are the contradictions of RFA? First and foremost thing, if you are having desire for fertility or pregnancy, what is that? We've already discussed that you want to preserve the uterus. Why do you want to preserve the uterus? Because you want to preserve the uterus for fertility, right? See, RFA is not a procedure wherein a lot of trials have not been made on RFA. So we do not know the outcome of the fertility or the outcome of the pregnancy and after an RFA treatment. So that is something to worry about because there is not enough study done on RFA. Second thing, if there is any sort of malignancy confirmed or suspected, you cannot perform an RFA. Apart from that, if you are having any active pelvic infection, wherein you're having a nausea, you're having fever, you're having pain in the lower abdomen, all of these symptoms can be because of your PID, but the PID has to be checked through other tests. So if you are confirmatory or if you are confirmed for a PID infection, then RFA might not be the option for you. Apart from that, as we have already discussed, if you're having larger fibroids or more number of fibroids or atypical fibroids, what do you mean by atypical fibroid? The fibroid composition should be in a certain manner. If the composition is different, it can be suspected as malignancy. So any suspicion also will contradict RFA treatment. So these are some of the contradictions. Let's see other contradictions also. Very large uterus or fibroids which are not accessible. This is also one of the contradictions for RFA. So what do you mean by very large uterus? Sometimes the fibroid size grows so large, or there can be a condition where there is fibroid along with bulky uterus and the uterus starts to look big. In that condition also RFA might not be the procedure. And also if the fibroid is not accessible or not in a location where they can access properly and treat it properly, it is a contradictory factor for RFA. Apart from that, if you have severe adhesions or distorted pelvic anatomy, what do you mean by distorted pelvic anatomy or pelvic adhesions? If you have seen our videos previously, you will understand that whenever there is an infection, whenever there is some problem, the body tapes all of the organs together so as to restrict the infection. It tapes it like a plaster. If you're having any sort of adhesions like that, RFA might not be the procedure for you. Apart from that, even though RFA is a very minimally invasive procedure, it is an invasive procedure, right? Although if it is minimal. So if your blood is not clotting on time or if you're having any bleeding disorders, that can lead into an issue. So coagulation disorders, if you're having any sort of coagulation disorders, then that is also a contradictory factor. Apart from that, if you have any implanted electronic devices, what do you mean by implanted electronic devices? If you have any pacemakers or if you have undergone a surgery where they have put some device in your body, it can be rods because of accidents to your bone, all of these things. If you have any sort of implants, then RFA procedure should be done very carefully, or it is better to avoid RFA procedure. So these are some of the contradictions for radiofrequency ablation for the treatment of fibroids. If you are someone who is suffering from fibroids or endometriosis or adenomyosis or polycystic ovaries or dysmenorrhea or PID, remember that Fidicus Homeopathy is the best way to cure all of this. We have two types of consultations here at Fidicus Homeopathy. One is the online option and second is the offline or the in-person option. If you are someone who is staying near the nearest branch of Fidicus, you can come and contact us in person. If you are someone who is seeing this video and are far away from us, you can contact us online through audio consultation options or through video consultation options. Once the procedure is done and once the case is taken, we will be asking you for investigations, and any sort of already done investigations can be shared with us. After the whole procedure is done, especially to our online clients, we will be delivering you our medication. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. Anywhere across the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call us on this number, WhatsApp us or messages. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who is suffering from female reproductive organ diseases, it can be fibroids, endometriosis, adenomyosis, PID, dysmenorrhea, polycystic ovaries, remember that Fidicus Homeopathy is the best way to choose your cure, because Fidicus Homeopathy stands for highest chance of health. Here we surely follow 3 principles. The first one is having highest success rate in already treating the existing disorders related to the female reproductive system. We have good number of cases where the outcome is very good and the recurrence rate has decreased. And also we have transparent treatment principle, wherein there is no gray area between the patient and the doctor. We will be discussing it with you about the prognosis of the case. And third is the personal care here at Fidicus is top notch. If you have any sort of misunderstandings or queries related to your problem, they will all be clarified. If you want to choose health, if you want to choose cure, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.